Hello, this is Jordan with this week's patient update. I'm excited to share some changes in a couple of our current patients' treatment plans as well as an exciting release, so let's get started. The clinic was thrilled to organize Golden Eagle 2514's release back into the wild after a long road to recovery. This patient came to the clinic from Rock Springs, Wyoming with a left metacarpal fracture and head trauma. After about 6 weeks of care for this patient's fracture, along with weeks of physical therapy and flight conditioning in the clinic's flight barn, this patient was released back in Rock Springs. Teton Raptor Center's research team also fitted this bird with a backpack-style tracker so we can monitor this case's progress post-release. Great Horned Owl 2535 came from Bondurant, Wyoming with head trauma, but has since recovered and has been doing very well in a large PCU unit for the last couple of weeks. With the space having opened up in the flight barn, this patient now has a larger place to increase their daily flight conditioning and perform live prey testing in preparation for what we hope to be a prompt return to the wild. Here's some footage of some of their first flights in the barn. Paragan Falcon 2545 from Idaho Falls, Idaho has come a long way in the recovery of their left metacarpal fracture. Recently, this patient's wing wrap was removed and their course of physical therapy was finished once the left wrist that had needed to be immobilized was back to its full range of motion. This patient is now in a larger PCU unit, starting some early flight conditioning. While the fracture stability and the wrist's range of motion are promising, falcons rely heavily on fine-tuned flight mechanics to hunt. Because of this, we will be monitoring this bird's flights carefully to ensure that the fracture has not left the bird with any flight asymmetry between the two wings. Osprey 2561 came to us from Rexburg, Idaho as a gunshot case with 2 metal BBs in the shoulder girdle. This patient also initially presented with severe anemia likely due to the gunshot wounds. It would be especially risky to operate and try to remove these pellets with this patient's pre-existing anemia, as there is a risk of further blood loss during surgery. For now, the clinic has been providing this patient with supportive care in order to begin blood cell regeneration. This Osprey's anemia has greatly improved with a 30% increase in packed cell volume, or the amount of red blood cells in a sample, within the first week of care. In this slide, you can see immature red blood cells, which provide further evidence of cell regeneration. With the anemia having improved so much, we can now consider if it is safe to attempt the removal of the pellets from the Osprey's shoulder girdle region. And that is all for this week's patient update. Thank you for joining us. Remember, if you want to do your part in helping to keep wild birds wild, then you can click the link in the bio to donate or visit our website directly. Thank you.